Hi everyone, this is Dr. Diane Hayden with Natural Nutmeg Magazine, and welcome to our Lunch and Learn series where we interview experts on everything from how to deal with the COVID-19 situation to uplifting interviews on holistic lifestyle, how to lead a healthier lifestyle and integrate more healthier things into your daily life. I'm excited today to have with me Dr. Jaquel Patterson. She's a nationally and internationally recognized naturopathic physician, sought-after speaker, and best-selling author. She is the medical director and owner of Fairfield Family Health, a multi-disciplinary integrative medical practice in Fairfield. Her areas of specialty are Lyme disease, autoimmune conditions, anxiety and depression, and PANS/PANDAS. She's the immediate past president of the American Association of Naturopathic Physicians. So thanks so much for being with us, Dr. Patterson. How are you today?
Good. Great. How are you? I'm really happy to be here to talk a little bit about what we focus on in our practice in Fairfield. So thank you for having me.
Awesome. So we'll start with, what's probably still on everyone's minds, and that is basically, how we're all dealing with the ever-evolving COVID-19 situation.
Yes.
And, I've had a lot of practitioners on talking about, different ways of how they're treating it with their patients, from a preventative standpoint to if they're actually seeing patients who have been diagnosed. So we'll just start there and we'll just get into basically how do you handle that in your practice? What kinds of things are you seeing and what are you, doing as far as prevention and treatment?
Yeah, sure. So we've had over probably around 15 of our patients that have been positive for COVID, and it's actually all have been successful in terms of their outcomes. We've definitely had individuals in the high risk categories in terms of chronic disease conditions and by age that have panned out really well, to the point where we've actually been asked from one MD called me to find out what protocol we had the patient on because they hadn't seen such a big shift of somebody in improvement in 3 or 4 days. So with really in terms of COVID, I think it speaks now more than ever about the importance of just lifestyle management, right? Because the people that were affected the most were individuals that had chronic disease conditions or things like asthma. I'm an asthma sufferer myself. And those just made you more higher worsened outcome, basically. Mm. And so to me, in terms of what we're recommending to patients, we definitely had put them on immune support, specific vitamins and nutrients, many of which have been researched and studied as it pertains to helping with like an antiviral component, helping with what they call your helper cells, your immune function. So we've put people on a lot of that baseline support, but then we also focus on all the back to basics, getting your sleep, eating well, also maintaining your stress. So those are 3 things that have actually also at the same time for most of society has also gotten the worse, right? Like I think the first month after coming, even myself struggled with sleep. My sleep rhythm was off because we're now working from home. And the whole schedule is different. I think it was like a 500% fold increase in alcohol, like everyone drinking alcohol every night, which is
because package stores were deemed essential
businesses. Exactly. It was essential for us to get alcohol, right? Yeah. So it's really interesting because a lot more people are drinking alcohol, and alcohol usually is contained, especially beer, with a lot of sugar. And sugar depletes your immune function. It actually blunts it, depletes it. So we're doing all the things right now that are like the worst things to do, drinking a lot of alcohol, eating poorly. And I understand the eating piece because we are also limited, right? A lot of people had fears. Many of you who are listening in may have fear going to the grocery store. I mean, I personally was very uncomfortable the first month or so. So you're just kind of like, you're not being thoughtful. You're just kind of grabbing everything that's available. The things you usually grab are the comfort foods, right? So working with people on like being careful and planning it, like getting it through Instacart or these other services online where you can be really mindful about how to order food and prepare as much as possible. So that tended to help people as well. And then movement's been huge, especially now because a lot of us are getting a lot less movement. I'm a big proponent of exercise. I love to exercise, but even for me, I've had to in midday breaks, like go walk for 45 minutes or walk in the morning before I begin because I'm sitting so much more. Because in the office, I get up, I talk to staff. I'm not really doing that the same way because everything is telemedicine right now for us. So like all of the back to basics, getting in nature, obviously, exercise, lifestyle, all the things that are going to support your immune function and to keep you healthy is really, really critical right now. So that's what we worked on with our patients. And the ones that have actually were positive or were susceptible, let's say like having asthma, we put them on things that were, made sure that their lungs were working really well and were supported as well as possible, making sure, that high antioxidants, making sure their lungs were clear. So there were very specific protocols we put people on for that as well. That was very targeted based on the person. We also are obviously following all the CDC requirements, masks, 6 feet distancing. We did telemedicine, so now we're going back into the office and we have full PPE. Some people might think it's excessive, but I mean, I'd rather,
yeah,
I'm fine with it. I'm safe. If I do it, I'm not going to do it halfway. Right. So we're doing that, making sure all the patients, when they come in, they wear masks. We call them from the office. So we're doing as much as we can and just watching where things go. I mean, I know the rates are going down very significantly in terms of, and also just most of the people are, remember, asymptomatic or very few symptoms. So also keeping that in mind. So really the best thing we can do right now is just making sure we're as healthy as we physically can be.
Yeah, that's great. I mean, some really good points that you brought up are, as far as just the situation that we're in that many people don't think about in terms of everyone having to basically be in their house. I mean, now, if you used to have to go to a location, now you're in your house where your refrigerator is full of food, or your cabinets or whatever, and it's easy access. So exactly. It's like all these other levels that we have to think about that that kind of were controlled maybe a little bit for us before. Exactly. And like you said, it's great about the whole, how everyone is connecting through Zoom and, doing all of these conference calls like we're doing today and that kind of thing. But you're right, we're sitting more. So now we've got a whole issue with just being more sedentary. And, that's already an issue for many people who have a desk job.
Exactly.
And just stress. Like, I think a lot of people don't know or don't realize that there's such a connection to stress and our immune function. And so, we're all stressed out on a number of different levels, not knowing what was going to happen with this virus, just being confined in our home. Now we're with our family, which many times that could be great. And sometimes that can be very stressful,
yeah.
So all these other stress things, coming into play that we probably, we don't really consciously think about, but that does have a huge effect on our immune system.
Yes. And so the stress has probably been the number one thing. I think when this all happened, the first thing that came to us is like, what do I do for my immune system? And we have a lot of patients that are vulnerable because like you mentioned, we deal with a lot of patients with Lyme disease, tick-borne infections, autoimmune conditions. Probably the majority of my practice lies between that. And also people that, interestingly, also have I'm also a member of American Academy of Environmental Medicine, the only one in Connecticut. And so mold exposure is one of the things we deal with. And I had a lot of people come to me about, what do I do now? I have to be in my house. They have mold, they have chemical exposure. So things like that have made them maybe feel sicker. So part of it is, how do we support that? Because so that was the initial part, immune system. And then after like 2 or 3 weeks, everybody was coming down with like, I'm really anxious. I'm really stressed out. Like, what do I do? So we have very specific targeted like amino acids we use that we put people on based on, just evaluation to help support their stress. There's also a lot of teas I love, like passion flower tea, valeriana tea, chamomile, kava. There's a lot of teas that also will help to relax you and also before bed. So, and then also just like meditation and some of those basic, again, lifestyle things that we worked on. But stress was probably like 2 or 3 weeks after that whole focus on your immune system. It was all about stress, like CBD oil and, all questions about that too from our patients, which makes sense, but it was good. People were proactive and realizing it and seeing it and trying to take action and doing something rather than avoiding it or continuing to just, drink alcohol and kind of being in denial, trying to say like, okay, what do I actually need to do about this? Because this is going to be here for a while. I mean, it's probably going to come up again in the fall. It's a cold disease. Really 2020, all of the 2020, it's going to be kind of like a watch and wait to see what really happens in terms of the updates.
Yeah. I mean, I think that's a big thing that causes a lot of stress for people is just the unknown. Like,
Mm-hmm.
you know, how long are we going to be dealing with this? First, it was how long are we going to be dealing with having to be confined to our home and not being able to go do the things we like to do. And now, as things are opening up, the stress is more about, okay, is it really safe to go do what I want to do and, you know, be around large groups of people and that kind of thing. So it's great to hear that your patients are being proactive and realizing that, you know, they are dealing with stress and how can they get support and that kind of thing. And everything that you said, I think is fantastic. And being a huge, you know, my background's exercise physiology. So my thing is
Oh, okay.
always, yeah, hey, like exercise. And especially now that it's, you know, getting into summer and nicer weather, at least we can get out, we can walk. That has such a huge positive effect on your mood and stress, you know, reducing stress and anxiety and that kind of thing.
Exactly. And so, yeah, all of those pieces are really important. And also one of the things I had done, like basically a series of interviews with some other doctors. And one of the interesting things that the thread across was about having compassion and grace. So about to ourselves. So part of, you know, with my patients saying, you know, we're worrying about, I'm not eating perfect. I can't stick to this diet. It's like, okay, you're doing the best with what you can. So also making sure, even with the stress, like I shouldn't be this, like being mindful of the words you use, because this is nothing that we could have ever predicted, right? And so the dynamics, like you said, there's going to be the unknown, and we have to realize that we can only we can control what we can, but there's really no control because we don't know. So like, when is the right time to feel like we can go and, you know, socialize or all these other pieces? It's really, unfortunately, time will tell. So that doesn't work so well for people that are anxious, because there's not that clear, you know, that clear line in the sand. However, you know, just being mindful of not being too hard on yourself during this time too, and having, you know, compassion for yourself and what's going on, and just grace as well, that you're really doing the best that you can given the circumstance.
Yeah, I love that. And I've been saying, you know, all along, you can you can look at this as, you know, from a negative perspective, or you can look at it as an opportunity. And I think that it's giving the opportunity is it's giving us the space to kind of have these things come up, these emotions, and see how we deal with certain things. How do we deal with being, you know, kind of confined to our home, or dealing with the fear of the unknown, or that kind of thing. It's all of it can be looked at as an opportunity to see how these things come up for us, and then how we can choose to react to them.
Mm-hmm. And that is actually one of the interesting things, is I feel like people are socializing a lot more on video. Even me with my friends, I'm like, I have a lot of friends out on the West Coast, and we're doing a lot more like happy hours or virtual parties and those kind of things. And I'm like, wow, why don't we do this all the time? You know,
I
or
know.
gyms. Like I've had patients say like, oh, this is awesome. I'm doing my gym streaming. And like, I kind of would rather just do this forever at home. I like the option. So I think it's also making, like, in terms of how things will change, even telemedicine, a lot of my patients have preferred that now. Like, okay, this is a lot more convenient in my life. So I think it's really changed up the perception of just like how we also interact. It is definitely obviously good to interact in person, but I think looking at ways of conveniences for our life is also important, because time more than ever right now is like a premium, right? So this is also in ways kind of looked at like how we actually use our time, and can some of these things be, you know, remote or videos to really help improve our lives in a way, or connect as well.
Yeah, yeah, definitely the next best thing for versus being in live, being, you know, one-on-one live, for sure. So let's talk a little bit about your specialties. So you work a lot with Lyme disease and Lyme patients. So tell me a little bit about, you know, how you treat those kinds of patients and what kinds of things you do in your practice for that.
Yeah, so my practice area, so we're known as just Lyme disease specialists in the state. All of our, we have 6 different providers, multi-disciplinary practice. We have a naturopathic doctor, an internal medicine consultant. We have a nutritionist who's also a physical therapist. And so all the NDs in our office are very equipped in like Lyme disease and tick-borne infections. We also deal with a lot of other like bacteria, like Epstein-Barr, mycoplasma, some other things that commonly come up. So it's a common thing. We have many different protocols we use in our office. For example, Cowden protocol is one. We look at Beyond Balance. We have Zhang's protocol. We have Buhner protocol. We have Byron White, tons of them. And the other thing we have a focus on, there's only, I think, 2 other providers in the state. We were the first in Connecticut for immunotherapy. So we have low dose immunotherapy as well that's specific for like Lyme, other tick-borne infections, Epstein-Barr, and strep for people with like, for kids with PANS or PANDA. So we're very kind of nuanced in that, and depending on the patient who we get, we run a specific, work with certain lab vendors that have much higher quality assays to confirm like diagnosis. So a lot of people that have come to us with Lyme disease have went to like 6 or 9 doctors already, and nothing has come back positive, and they don't feel good. They still don't feel good, and they feel like they're crazy. I hear that all the time. Like, I feel like I'm crazy, or people thinking I'm making it up. And so, and then we go and test, and we find these tests that are positive, and then they get treatment and they feel amazing. And then there goes the other piece of just like, geez, I wish I knew that a lot earlier. So a lot of the patients we see kind of have fallen through the cracks. And then as well, autoimmune conditions is near and dear to me. Lupus is one that we see a lot, rheumatoid arthritis. Yeah, probably those two, lupus and rheumatoid arthritis. My mother had lupus, my aunts have lupus. So autoimmune conditions is something that we are very involved in. We are also like sponsors and in terms of the Walk to End Lupus and things like that as well. So those are the most common pieces we see. And when folks do have Lyme disease for a period of time, what I see, if it's like over 5 years, it very much, in my opinion, mimics like a lot of these autoimmune conditions, because your body at some point shouldn't keep, fighting, or shouldn't keep having this reaction to an infection. And so if it's continuing to mount this response, you want to think, is the not mechanism of action, but it feels comparable, or it looks very comparable to what it looks like in an autoimmune condition, when your body is like continuing to attack or fight itself. So we kind of approach it from that perspective, which is a bit different too, as well.
Yeah, let me clarify something, because that just sparked a question in my mind. You're not saying, or are you saying, that Lyme disease can progress into an additional autoimmune disease? You're saying that Lyme disease can present as these different autoimmune diseases.
It can present.
Right.
So it can present, thank you for clarifying. So it can present as similar to an autoimmune condition. So a lot of patients I've had, firstly, when they've come in and they've been to 6 doctors, if they've been, all the autoimmune conditions have been ruled out. So they're like, but I still have joint pain. I have it's oftentimes migratory joint pain, headaches, really bad fatigue, sometimes fevers, like low-grade fevers, sensitive, like photosensitivity as well, brain fog. I had that a lot. People with anxiety, never had anxiety. Now they're having issues with that and sleep, memory issues. And so what happens if you go and get worked up for that, those immediate things I said, joint pain, fatigue, and joint pain and fatigue, those 2 things are commonly seen with autoimmune conditions, right? And so, but these other things like headaches and things are not necessarily as common. And so they go get the test and they found that they're negative. But then when we come and see them, they never gotten ruled out for any of those tick-borne infections, and then they're positive, and those symptoms are very, very similar. So the symptoms presentation is very similar. But what I was saying also is that if someone has these symptoms for a long period of time, like Lyme disease, the way it presents is similar to how autoimmune conditions work. Not that it is, but it presents similarly in terms of this continual inflammation in your body that kind of doesn't go away, which causes all these symptoms that you're having.
Yeah, it's interesting. You earlier you mentioned people having sensitivity to mold and being in their home and that kind of thing. One of my close friends, her son actually started having all these issues, and funny enough, he was diagnosed with mold sensitivity first, and then they found out later that he has Lyme disease. And so it was actually the Lyme disease that exacerbated all of the issues with mold. So it's very interesting to me, how all of these things kind of work together. And it's, for you, it's like, I have so much appreciation, because it's like, you have to figure out this puzzle.
It's completely a puzzle.
Yeah. Like all the time of like, okay, it could be, like you're presenting with this, but it could be that these other things have been ruled out, but let's look at this. It's just, yeah, it's extremely, complex.
And it is a good point, because we definitely have many patients that have both Lyme disease and mold. And so one of the pieces as a doctor that you're figuring out is what is the most prevalent issue, because like if there's a seasonality to it, like if I have someone with Lyme disease and then they're like, I'm getting worse every fall and spring, typically it's because of mold exposure. So that means we need to work on the mold aspect too. But for them, Lyme disease might be the most prominent, it's maintained, but then once those types of years come up, types of months rather come up, their symptoms will get aggravated. And then some people, you know, are on Lyme protocols, they're on it for a few months and nothing is changing. And then we go, okay, something else is going on here. And I check and they have mold and I support them with mold and they get better. So yeah, some people can have two things, but one thing could just be more, like you said, affecting them more than the other thing is.
Right. So you mentioned that you were one of only a couple of specialists in Connecticut that treat Lyme disease in a particular way. What do you think is one of the most important things that sets you apart from other practitioners?
I think, well, firstly, we're very experienced. So like 80% of my panel, 78% is all Lyme disease and tick-borne infection. So that just in itself is not common. Most of the providers and that's a good question to ask. I think when you're speaking with any like integrative functional medicine doctors, their experience with it, how many and their percent of population. So for us, it's the majority of our population. So a lot of the stories people are coming in with, I've heard this story a million times. So there's that level of expertise and specialty in a very unique area. I'm also a member of ILADS, so I'm always constantly updated. I've trained with all the best in Lyme, you know, Richard Horowitz, Lee Cowden, Ty Vincent, which is where I've gotten trained for low-dose immunotherapy. Low-dose immunotherapy, which was that modality that we used for Lyme. There's only a couple hundred doctors in the United States actually that are trained in that as well. So it's very, very, very specialized. I think it's really the experience of doing it, you know, for years, but having like majority of the population. So a lot of the things when I talk to patients are like, oh, I'm not crazy. Like you've heard this before, versus, you know, I see some people with Lyme, but it's not like a big part of their panel. There's just a different level of like expertise and knowledge as a result of that. So yeah, so that's definitely what I'd say. And also being a member of Environmental Medicine Academy also exposes me to understanding like the environmental implications that could be affecting people. I'm also a member of Medical Academy for Pediatric Special Needs because we deal with kids with PANS and PANDAS, which is typically due to like a strep infection or mycoplasma. So again, we look at infections a lot in our office as the cause, potentially the initiating cause of disease. And so that also is different because not everyone looks at infections as it relates to how that triggers the immune system and how it triggers like a disease condition as well.
Yeah, well, it's so important, I think, that you find the right provider because I've known many people who have been diagnosed with Lyme and, you know, some of them early on and they seem to be able to get better fairly quickly. But I would say the vast majority are people that have gone to multiple different, probably started down the traditional medical route, then went to more functional medicine or integrative medicine type of specialist. But even then, spent years trying to figure out either what the diagnosis was and how to treat it to help them get better.
Yes, and that's what I get a lot. Like I've had probably, I say, of the patients with Lyme disease, at least half have been, many of them have been to Lyme litter doctors where they've been on, let's say, antibiotics for a couple of years. And they're like, they say they're feeling better, like definitely not the way they did before, but they're not like 100% yet. And so that's because the terrain, we have to really support the body terrain. You know, antibiotics were great and hopefully maybe getting rid of things, but not necessarily like that doesn't support the immune function. What we find a lot is that immune system piece might not be addressed in combination with doing things that help to, you know, get rid of the Lyme disease itself too. So that is a really important thing in terms of many of the people, having been diagnosed, have been dealing with these symptoms for like 5 or 6 years before they come and see you, or they've been seeing someone for a period of time. My recommendation I typically say is like, well, how long do I wait? I usually say 3 to 6 months. If you're with, you know, getting treated for that time frame, 3 to 6 months, and there's no change at all, you want to have at least a 20% improvement in symptoms, and you really want to make sure that the match, or really is it going in the right direction? Like we talked about, maybe it's mold, maybe it's food sensitivity. Like you need to start looking at other things when it's going really past that time frame.
Yeah, I mean, I think that's a good point. It's important for people to know, you know, some type of time frame that they should be looking towards in terms of starting to feel better or things changing. But I think it's also important for people to know that this is such a complex issue that they're not going to get 100% better overnight.
Very
true. And not to get discouraged. I think many people get really frustrated and discouraged. We're that society of instant gratification. We think everything is, you know, like, oh, it's going to be fixed overnight, you know, like if you have been dealing with this for years before it was actually correctly diagnosed, it's going to take a while for, you to get back to quote unquote normal. So that's to be expected.
It's
So
so true. And
yeah.
I think we're like that with really a lot of health conditions. And it's one of the reasons why when I have a patient come in, we go through obviously all the symptoms they have, but then each time you come back in, we review that because like you said, it's like the American way, we kind of forget. So for example, they told me they had headache every day, actually. This happens all the time. The headache one is a common one. And then they come back and I'm like, okay, how often? Like, oh, I kind of feel the same. And you go through the list of symptoms like, oh, you're having a headache every day? Oh no, I might've had it once, in the week. Or, oh, is your knee still hurt? Oh, I forgot about that. Yeah, my knee doesn't hurt anymore. Is your sleep better? Oh yeah, I'm going to sleep at 10 now. Before you used to have to go to sleep at 7:30. I literally have patients going to sleep at 7 o'clock because they're so exhausted. Because they're changes, but sometimes it's not like so dramatic overnight, but that's in a month. I have people change like that. And it's funny because you just move on to something else. Like, yeah, I have this, but I hurt really bad in this area, so they're just focused on like the shoulder pain and you forget sometimes, wait, you just got better in 6 other things. So that's one of the reasons why I always go through the list of symptoms again, because it's even myself, it's easy to forget because you kind of move what you're necessarily anxious about. A lot of people do remember, but for people that are really like busy and active and they want to be at 100%, sometimes we're not looking at the fact that you had 40% improvement in 6 weeks, which is huge. So I think reminding and going through that and keeping your own list, like as patients, is really helpful because it's easy to forget, very, very easy, because we can move on to something else.
Well, sure. It's also human nature, I think.
Mm-hmm.
We're not focusing, we never focused on the good things that happened to us, or we don't focus on them for very long. It's always like, oh, what's this negative thing that's happened to me? Or, what kind of pain am I in? Or what am I feeling that's bad, so to speak? So like, that's what we tend to put our energy into, unfortunately, when, it's great that you have people go through, like you go through those questions and you get them to remember, oh yeah, I did have headaches and now they've gone. And so that just puts us in that mindset of, okay, let's focus on what positive things are happening and what good changes are happening. And now I feel, even more proactive about what I'm doing.
Mm-hmm, exactly. And so mindset's really big on that, like how, what you're being careful. I always tell people, be very careful with your words. Like, am I never going to be better? Or I'm going to have this for the rest of my life. I hear that too. And it's like, well, no, I mean, one of the pieces is I've had patients, their time will spread out. So it's like, oh, instead of getting a flare every month, it's every 3 months. And so sometimes people get frustrated, like, oh my gosh, I'm never going to get rid of this. I had a flare in 3 months. I'm like, remember, you were having flare at least twice a month before. So like those are changes, it's spreading out. So over time, it's going to dissipate where you're not having any of it. So I think it's natural to do that. You can get quickly kind of go down that rabbit hole of, oh gosh, is this going to be forever? So kind of reminding people of that and those affirmations and just being mindful of the words. Like if I have back pain, I have back pain. I sometimes have low back pain. So I've had to stop saying, even myself, like, oh, I always have back pain, or I'm going to have, instead of saying like, I'm going to not have it, or I'm going to wake up in the morning and it's going to be, I'm not going to have any pain. So like being mindful of those words can make such a difference on your health status, because your mind will send messages to your body, and ultimately your body will show what your mind is also ignoring, by way of your health. So those things are also really important as a function of your health as well.
Yeah, I totally agree with that. Where you focus your attention and where you focus your energy is what will persist, essentially. So yeah, it's really important to be aware of the things that you're saying, the words that you're using, that kind of thing. So that's awesome. So tell me a little bit about your work with PANS and PANDAS.
Yeah, so PANS and PANDAS, so basically it's called a pediatric acute, for people that don't know it, neuropsychiatric syndrome. So what happens is the symptoms that you'll have, a parent will come in, typically anywhere between like, I'd say 5 years to 16 years of age. And the parent will say, oh my gosh, my kid has changed like overnight in terms of a lot of anxiety, tics. Some people have vocal tics or movements. They'll have sometimes like oppositional defiant, like very defiant, very moody. Sleep issues is pretty common. Just complete change, and a lot of anxiety, like anxiety is really high, as well as OCD. So those are symptoms that come on. And so I've had patients where literally will say like, I've had one said, my kid went into the shower and they came back a different kid. Like scared to take a shower by themselves, need to sleep with them. And so what they found, it's a little bit more progressive in terms of this diagnosis, PANS and PANDAS. And so basically what they found is there's a connection with different bacteria. So strep is one, and mycoplasma, there's another one. Actually, other infections like Lyme disease is considered another one too for PAN. So there's what's called PANDAS, which is due to strep. And then there's PANS, which can be from other infections like mycoplasma, Lyme, et cetera. And basically what they found was that that's the triggering agent, which causes all those symptoms I mentioned. So what we do for patients with that treatment is we really do things to help, like natural antibiotics for a period of time, natural ones though, herbs in terms of helping to get rid of that load, because we retest with blood work to see what their numbers are. Also all the pieces, because it is considered neuropsychiatric, like kind of autoimmune connected. So again, stabilizing the immune function. And then also we do what's called low dose, again, a low dose immunotherapy. And we have low dose immunotherapy is dead irradiated protein receptor of things like strep or mycoplasma or Epstein-Barr. Epstein-Barr is connected. They show it's called molecular mimicry, very similar to other autoimmune conditions like lupus, Hashimoto's as well. So we look at those like specifically giving low dose immunotherapy for those kids. And it's amazing because you only need to do treatment for it like every 6 to 8 weeks. And I love seeing kids because they come in it as fast as they like went out. It's like amazing. So I'll have a kid that had like vocal tics, OCD. We do one dose of low dose immunotherapy. It's like night and day. I mean, 100%, not like 20%. Oh, they're a little bit better. I mean, like literally overnight. Obviously, that's not everyone, but a large proportion are when you get the exact right low dose immunotherapy. So we usually use LDI for that. But I just love seeing kids with PANS and PANDAS too for that reason, because it makes such a change in like the whole family dynamic, because it's a big stress on the whole family altogether.
Yeah, that is amazing. I mean, I feel like kids they still have the, what's the word I'm looking for? It's almost like a subconscious innate nature that they know how to heal themselves with just a little bit of help. Whereas once you get to a certain age and we forget that we have that ability to do that. And it almost makes it that much, or it does make it that much harder for adults to heal themselves essentially.
Yeah.
And,
yeah. And there's a lot of studies on it. It's called like the neural pathways, where we kind of always sequence things over time as we get older into a certain way of the end result. And kids are just, like you said, so open and fluid. And it always, to me, it's exciting because it just shows the power of like alternative medicine, because kids have no
preconceived
opinion.
notions.
There's
Yeah.
no preconceived notion. There's no feeling, like no one's telling them don't have a tick anymore, OCD. They just get it. They have no idea what it's for. They open their mouth, they get therapy, and then they're better. And you're like, there's no influence from that. It's not placebo. So that's kind of the other cool thing I love about it, because it's like kids are like, or animals, but we can't see animals, but I know some people, like vets and things like that treat with it, but that's like, there's just no biasness, and there's just complete openness. So it's really neat to see, because they're not filtered. So, when it's working, it's really the thing that worked for them, and there's no other influences outside of that.
Yep, they're a clean slate.
Exactly.
Awesome. Well, this has been an amazing amount of great information. I'm sure that people are going to want to reach out to you. So tell us how we can connect with you, what any kind of contact information you want to give for people.
Oh yeah, so our business is, I'm, Dr. Jaquel Patterson. Our business is Fairfield Family Health. So our website is fairfieldfamilyhealth.com. And then you can also call us 203-254-9957. So that's our office line, but definitely check out our website, Fairfield Family Health. And we're on all the social media handles, Facebook, Twitter, Instagram, just at Fairfield Family Health. If you want to check us out there, we do videos and lives and things like that to get information out. And we're still doing COVID antibody testing. So we're doing that on Thursdays. And so we're also opening up to the community for people that are like non-established as patients. We're doing kind of these mini consults. We were actually on Channel 12 News about it 2 times for our antibody testing. So if you're interested in that too, you can feel free to give us a call to just get more information and learn how to set that up as well.
Okay. Are you still doing telemedicine?
We are still doing telemedicine. We are starting to come in for people like new patients who we need to get blood work with all those precautions I mentioned earlier. But we definitely are doing telemedicine fully. Basically, people have both options.
Awesome. Great. Well, people can check you out at fairfieldfamilyhealth.com and on our website at naturalnutmeg.com and our social media sites at Natural Nutmeg Magazine. And I want to thank you again, Dr. Patterson, for all the information today and hope people will connect with you.
Yes, thank you so much for having me. Feel free definitely to reach out. We also do, I forgot to mention, 10-minute complimentary consults. So we could also talk if there's any questions about our approach in working with you. But thank you again so much for having me.
Great. Awesome. Hope everybody has a great day.